Sync with what you have given the UN definition. The second point to note is that at CEDAW or under our jurisprudence, gender-based violence is a form of discrimination against women. You know, our mandate is discrimination against women, and that gender-based violence, therefore, because it disproportionately affects women, is a form of discrimination. Now, when we move from there, the CEDAW Convention has 16 thematic articles that deal with the areas in which discrimination is seen or is very prominent against women. In addition to that, we have our jurisprudence buffed by the general recommendations that have been articulated to fill in the gaps, to bring up our jurisprudence into contemporary times, to deal with issues that keep coming in the constructive dialogues for which states want direction or guidance. And so our jurisprudence, therefore, is made up of, first, the convention, our general recommendations, and the decisions that are given under the optional protocol. Now, let me begin with the convention. I talked about 16 thematic articles, and the work on discrimination on violence against women is based on Articles 1 and 2, discrimination against women and equality. And then Article 5 is the article under which we deal with violence against women. That's the one that deals with stereotypes. What we have found interesting and articulated in General Recommendation 19 is that all the articles of the CEDAW contain violence against women. When you go to Article 4, 1 and 2 we've already dealt with. 3 deals with the institutional mechanisms. They also handle the issue of violence against women. Article 4 is temporary special measures that are part of the strategies we use to deal with violence against women. Then 5 is the stereotypes. Indeed, it bears no discussion at this time that stereotypes are discrimination against women and are also forms of violence against women. The stereotypes in the harmful practices, you have alluded to female genital mutilation, marital rape, and the cultural underpinnings, the patriarchal and cultural underpinnings under the stereotypes are wrought with violence. Then Article 6 deals with the exploitation of prostitution and trafficking. Again, I do not need to explain the implications of violence against women that are in there. Article 8 7 and 8 deals with women in public office and in the international environment. Increasingly, we are hearing about, it's been there all the time, but research by the IPU and several entities are throwing up the issues of violence against women in politics and women who seek political office. It's sometimes direct, physical, it is sexual. The greatest part of it is psychological and technologically mediated through social media. So that's Article 7 and 8. Even women who aspire for public office face violence in that process. We come to Article 9, nationality, and here the issues around documentation, getting identity documents. We also know the processes and the forms of discrimination and violence that accompany these processes. 10 is education. Sexual harassment in education, the forms of discipline, punishment, facilities also have ramifications in violence against girls, women and girls. Let me here take an aside. And thank you, BC, for mentioning the issue of sex grades. Someone remarked to me that it should be the other way around. It should be grades for sex. When we call it sex for grades, it implies that it's the person who is offering the sex to have grades. It does not take account of the power, play, and dynamics. It's rather the person offering grades or giving grades was asking for 6. So maybe we should look at this. We should look at this within the area of violence against women in education. Then Article 12 deals with health. We recently also the special rapporteur on causes violence against women, causes and consequences, has issued papers on obstetric violence, violence against women within the process of delivery. You've talked about the selective abortions, forced abortions, and all that. We have violence against women there. That's Article 12. 13, social and economic benefits. Yes, again, we have issues of violence there. 14, rural women, because of their alienation and distance from the centers of service provision, access to justice, also suffer a disproportionate amount of violence in all aspects of their life. And 15, access to justice, equality in law, and then 16 in the family. And again, that is the most perverse and deep form site for violence. So what have I said? I've said that in all our 16 articles, we have violence against women. And violence against women is a form of discrimination against women. So in every one of those articles, the issue of violence is present. And again, General Recommendation 19 says that even where violence against women is not mentioned specifically, we are entitled to look at and determine the forms of violence that exist within those contexts. Having said that, at the CEDAW committee, you asked how do we deal with violence against women? We deal with violence against women through the reporting procedure, where states issue or submit their 4-yearly reports on how they have handled all these issues, all these thematic articles. And clearly you have seen the violence in each and every one of these articles. We have a constructive dialogue. We issue concluding observations that states are supposed to comply with. And we have the issue of the follow-up, where we pick the 2 most important or pressing issues and ask for a report within 2 years or any other specified period on those burning front issues. We also have our optional protocol procedure, where complaints can be brought, there are conditions for them, for bringing the complaints. And we have the individual complaints, as well as the inquiry procedure, where the committee can investigate grave and systematic violations of its provisions. So this is the way in which we generally deal with the issues of violence as they come up against it. You have rightly flagged the issue of the COVID-19. It is common knowledge now that the COVID-19 has exacerbated issues of violence against women. Women's situations have been made worse, and the pandemic has opened the fault lines that had already existed in societies, mainly because of the discrimination and the lack of equality and the inability of structures and processes to deal with these situations. And the pandemic has just exacerbated it. So we issued in April this year a guidance note on CEDAW and COVID-19. And this was to address the disproportionate impact of violence on women, or of the pandemic on women. Already I've told you, I've explained that all the provisions of all the articles have implications in violence. And therefore, as we go through this guidance note, we have flagged out particular issues. We've asked that the disproportionate impact of the pandemic on women's health, and in particular their mental health, because we have talked about the psychological aspects of violence, be addressed by states parties. And the provision also of sexual and reproductive health as essential services must also be an area that must be paid attention to. We know that even in the best of times, women's access to these services are difficult. And the pandemic, with its restrictions on mobility, with its change of focus in the health sector to issues of the pandemic rather than sexual and reproductive health services, which are mainly sourced by women, is apparent. In the early days of the pandemic, we did receive reports that women were not going for antenatal services because of fear of catching the COVID. And therefore, these services were being self-delayed by women, even though many countries had made advances there. We also looked in that guidance note about protecting women and girls from gender-based violence. And we also have reports that the pandemic, with its social distancing, the isolation in the beginning, the quarantine, the instructions to remain at home, put women and the perpetrators of their violence in close contact. And there was not the ability to go and report. In any case, the reporting agencies were concerned more with the effects of the pandemic. It also had an impact on the data that was generated. At this time, in certain areas, jurisdictions, there were more cases of men reporting violence. And the initial reading was that women were perpetrating more forms of violence against men because they were close together, including psychological violence. What a close analysis of the data showed was that it was because women could not go out, they were restricted. So it was the men who were going out. So even issues of data analysis and reporting was impacted by violence. Then also, the issue of ensuring equal participation for women in decision making, particularly in the context of COVID, in the context of what policies, you've spoken about policies, what policies should be made, how women would be an integral part of the entire policy making continuum, and in particular, social and economic intervention aspects were also issues that are dealt with there. Education is a very important area. You know, schools have closed down, girls have stayed at home. Many of them have gotten, not many, we had quite a few cases of pregnancies during this COVID situation because girls are at home. We have noticed that the COVID has impacted women's education in three main ways. Women, first of all, as users of the education system, where they leave their that they can pursue their economic ventures, it's been truncated. Women as users of the education system, learners, and women as the ones most greatly employed in this area. So they've lost livelihoods and make them more vulnerable to violence, especially in the private education delivery system. So I've already spoken about the sex for grace for sex issues there. And the other point we've noted there is the socio-economic support to women and the necessity of making sure that women can take advantage of the opportunities provided by the COVID-19 in engaging in economic ventures, the production of personal protection equipment, and so on. That is an entry point. Market opportunities and procurement opportunities within the pandemic is also there. Then targeted measures for disadvantaged groups of women who are vulnerable or targets of violence, making sure that the measures include these groups of women, empower them, make them active participants in the COVID economy and not expose their further vulnerability to violence. We look at the intersectional discrimination, the various groups of women, migrant women, refugee women, indigenous, women deprived of liberty, and I'm glad Emile is here today to throw light on this that we have identified in our guidance notes, and women and girls in humanitarian settings. And above all, we ask for the strengthening of institutional responses. If our national women's machineries, our national human rights institutes were as strong as they ought to be, it would provide some resilience against the impact of COVID, especially on violence against women, the violence against women aspect of the COVID-19, and then the importance of data and the dissemination of information. Finally, let me talk about access to justice. We have looked at the fact that justice should be accessible, affordable, adaptable, and of quality to ensure that if all the jurisprudence, if all the intervention, if all the content we have generated and processes do access to justice, which is the bridge between rights and their implementation. I thank you very much. And pardon me if I have slightly overstepped the time allocated.
Not at all. Thank you so much for such a brilliant delivery of your presentation, and you managed to touch on everything. And thank you for correcting me. It's not grade the power display there. It's grade for sense. And then, yeah, that's something that I'm also glad that you also talked about the aspect of the education and the effect of the lockdown on girls' education and the impact on the livelihood of women. We'll come back to you with some questions and also on the data and dissemination of information. And I know you mentioned the guidance note that CEDAW sent out. I will also come back to that. I would like to go quickly to our next speaker because she has to leave us very soon. So I would like her to come on board now and then, so that she will have enough time to take some questions before she rushes up to her next meeting. Nankali, thank you so much for honoring my invitation and for joining us this afternoon. Over to you. Nankali will speak to us on the effect of COVID on harmful traditional practices and what lessons can they take from that.
Okay, thank you so much, Bisi. Thank you for the invitation, and nice to see Caroline, my counterpart out there. So good to be in familiar ground. Bisi, will you project the PowerPoint, or should I do it from my end?
I think you can share.
Okay, all right. Oops. It tells me that you have disabled it, so it's not letting it happen.
Try it again.
It's okay now?
Yeah, can you see what I'm presenting? Can you see the PowerPoint?
Not yet.
Oh, have you
to click at the share screen?
Yeah, I did. 1 second. I'm sorry, colleagues.
Yeah. Good. It started.
You're good. You're good to go.
Can you see it now? Okay.
Yes.
Brilliant. Let me just put it on 4. Okay, you can still see it, right?
You can.
Okay.
It's coming up as presentation mode, so we're seeing all your other slides. The next slide.
Oh.
Yeah. So what you do is click on display settings at the top. Right at the top, can you see the menu? Display settings at the top, where it says show tax bar, display settings. Okay.
Yeah. Then go to
yeah.
Then click it. Click on that.
You click on that. Okay.
Yeah.
And then
you need to get your cursor. Okay, actually, it's me too. Okay. You know what? Do you want me to share the screen?
Yes, please.
Okay. All right.
Come on. Stop sharing.
Okay, and let me go into yours. Zoom. There we go. And I'm just going to do that.
Brilliant. Thank you.
There you go. And you just tell me when you want me to go to the next slide. Okay.
All right. Okay. Thank you so much, colleagues, and sorry for that initial technical challenge. So my name is Nankali, and I work at UNICEF headquarters. I'm a senior advisor on child protection, and Bisi asked me to talk about safeguarding the rights of girls to be protected from harmful practices during crisis, and what lessons have we learned from COVID-19. Now, my portfolio includes working on child marriage and FGM, so I will talk within the context of those two. And it was really great to have that initial presentation just to look at CEDAW and what it says around violence against women and girls, in addition to, you know, these harmful practices. So next slide, please.
Sorry, when it's on Zoom, it's so slow. Come on. Okay, there we go.
Okay. So I mean, just to take ourselves very quickly back, colleagues, when we first started the COVID pandemic, our reference point for most of us was Ebola. And so we looked back into, you know, the documentation, the research that had been done within the context of Ebola, and then use that as a reference point to be able to design, you know, the programs that we were going to have for harmful practices. One of the key lessons, colleagues, can ask, I think somebody's unmuted, if we can all mute. So one of the lessons that we took from it is that, you know, no two pandemics are alike. We quickly found out that a number of things that the way that the community communities responded in the way that we designed our programs was not going to be similar. So for example, during the Ebola crisis in Sierra Leone, FGM rates went down. So, you know, communities stopped the practice, went back into their households. But as soon as the outbreak was declared to be done, the practice picked up immediately. Now we have the counter effect within the COVID experience. FGM, the practice has carried on throughout this period of time. This is despite containment measures or any other measures that have been put into place. And so one of the big lessons that we're taking away from all of this is that no two pandemics are alike. And it's really important for us to be able to learn, you know, what type of pandemic and how communities are going to react within that environment. Next slide, please. So, you know, we've had a number of agencies and partners look at, you know, the impact of COVID, especially when it comes to, you know, adolescent girls within this period. So at the moment, we know, or we have estimations that 13 million additional cases of child marriage may occur by 2030 because of COVID, that at least 10 million girls are at a higher risk of never returning to school. We know that as a result of the containment measures, one of the key things was to stop children from going to school. But the challenge that we're facing now is that how can we quickly be able to get girls back into school in a safe environment, of course. And we know that the longer that girls are out of school, the less chance there is of them being able to come back to school. And at the moment, at least 10 million girls, you know, are at a high risk of never returning back to school. 117 million children will be pushed into monetary poverty. We have a lot of information now around the socioeconomic impact of COVID. And so we know that children, adolescent girls and their families, you know, quite a number will be pushed into poverty as a result of COVID. And then we also know that 2 million additional cases of FGM may occur by 2030 as a result of COVID-19. Now, just putting these numbers into context, when we began 2030, we came in on a really high note that, you know, we have our decade of action. We have 10 years to get to 2030. And for both child marriage and FGM, our commitments have been to get to elimination. So COVID has, what I'm communicating within this slide is that COVID has created a situation where we were making progress before COVID. When we looked at estimations from surveys before 2030, we were making progress. However, we were not at the rate of progress that we required to be able to achieve the elimination target. And now, as a result of COVID, we may have gone even more off track in terms of achieving those elimination targets. And so the challenge for us as a community is to look at what are the things that we can do to get us, you know, one, you know, kind of back on track in terms of ensuring that these harmful practices carry on to decrease in number, but also to get us at the speed that is required for us to achieve elimination by 2030. Next slide, please. Now, the economic fallout and school closures, as I've said, appear to have exacerbated harmful practices. So we know that, you know, and it was great again to hear the last speaker refer to this. As adolescent girls were at home, they've taken up different chores, domestic chores within the house, increased more than they've done before. They're also the ones who are taking care of sick caregivers, and some of those might have COVID. Because you have more children at home, families are adopting negative coping mechanisms such as child marriage. There's too many children in the house. They can't be able to feed them because some of these children will go to school during the course of the day. And so they're looking at ways to be able to survive and to cope under this increased strain. And one of the negative coping mechanisms that they're taking up is child marriage. Within the African context, we know that for a number of countries, FGM is a precursor to marriage. And so a number of girls are now being exposed also to both FGM, you know, many of them, unfortunately, the night before and the next day having to get exposed to child marriage. Next slide, please. Now, in terms of the protection mechanisms, we know that we normally count on, you know, the police, we count on the judiciary, etc. But most importantly, we count on community protection mechanisms who are there, the kind of the eyes, the ears on the ground. And as a result of containment measures, these mechanisms have been weakened. So we didn't move fast to be able to provide PPEs for these community members. And you know, quite rightly, many of them have had to also protect themselves. So these containment measures have contributed to a weakened formal protection mechanism due to disruption in services or frontline services providers being pivoted towards a COVID response. So many of them, for those who are working, they were redirected into health type of responses. And for others, they just, you know, as a result of protecting themselves, were not moving around in the communities. And that meant that the adolescent girls that we have out there are by themselves in their households without anyone to reach out to them, without anyone to discuss anything with, and without their own social networks as well for other girls to socialize with. Next slide, please. Now, a crisis within a crisis here, one of the things that we wanted to highlight is that we have spent a lot of time during the course of this year talking about COVID, quite rightly, in how we design our responses and effective responses for COVID. But one of the things is that a number of countries, and you know, from my own continent within Africa, were already in crisis. Take countries like Burkina, for example. They were already in a humanitarian crisis, and so we've added a crisis upon a crisis, which means that we have even greater vulnerability for young girls within this context. And so as we design our programs and think about what it is that we want to do in terms of protecting these girls, we need to take note of the fact that they've been caught up within two crises, and as a result, their vulnerability has been increased even further because of the communities that they're living in and the situations that are going on within those communities. Next slide, please. So what have we learned about harmful practices in humanitarian settings? So one thing, experience has shown that girls that are at risk of harmful practices are often left behind. When we've gone back to look at often left behind in emergency situations, let me clarify that. I think the previous speaker also referred to this. When you look at the COVID response plans, what was initially set up, I mean, quite rightly, significant effort and energy was put around, you know, prevention of COVID, hand washing, communication, etc. But the issue of girls who are, you know, at risk, and especially adolescent girls in general, tended to be left out. Even when the pandemic is over, the issue of harmful practices and emergencies will remain a challenge. As I said, there are some countries where they were already in some type of humanitarian crisis, and that has gone on during COVID and will carry on even beyond COVID. And so we need to design our programs in a way that we're conscious that these girls came from vulnerability, had increased vulnerability, and that vulnerability will carry on for the next number of years in their lives. We need to work across the humanitarian development divide. Here, I think many of us have seen that, you know, we work in a very kind of vertical manner, the humanitarian world and then the development world. And this year has been, you know, quite interesting to look at how those two worlds come together, where when you have a global pandemic and all of us are actually in a humanitarian situation, and none can say that, well, we work in development and you guys work in humanitarian. The challenges that we've been faced where those two worlds have had to be able to come together to build on the best of each other's competencies in order to ensure that we remain on course in terms of achieving our elimination target. Next slide, please. So how can the global community be able to build back better? Some examples of things that we're proposing, and I'd love to hear from other participants on this call. Harmful practices such as child marriage and FGM must be integrated into emergency preparedness and response plans. We can't leave that out. And more broadly, of course, is just ensuring that the emergency preparedness and response plans are gender sensitive and take into account issues of both girls and women. And by virtue of doing that, these other issues will also be picked up. Services need to be adapted to prevent disruption. So we have a number of services that we already have, but we saw that we had to adapt them within this containment situation. So for example, having helplines, having mobile clinics and courts, etc. Community surveillance mechanisms, are sustainable despite the initial challenges that we had of community members not being able to move around freely. Those people still remain at the front line of response. And so once we armed them with the right protection mechanisms, they were able to move within the community. They were able to find out what's happening at household level and to highlight to mandated bodies where it is that responses were required. Community communications for social norms change are easily adapted to emergency settings. We've had a lot of, digitalization and information taking place through TVs, through radios, where people don't have to move around and link up with each other, especially because of the containment measures. We have also adopted those. And then digitalization, not only for sharing information, but also for ensuring that we collect data and we monitor. So lots of phone surveys that have taken place, surveys through WhatsApp, surveys through the internet, etc. Just using that to be able to ensure that we access information about girls and are able to respond effectively towards them. Next slide, please. Now, here are some examples, but of things that we've done, for girls' empowerment. Again, I referred to the digital solutions, but just referring to what the last speaker also raised. While we're all celebrating digital solutions and looking at them as a way to be able to continue to reach girls, and especially the most vulnerable girls, some of the key issues that have been coming up are, to do with the gender divide. So, for example, these young girls are not the ones who have phones. For those who are most vulnerable, their houses are not the ones that have radios or TVs. And so those households and those particular girls continue to be left out and not to be reached in terms of the services that we're providing. In many households, it is the father of the house who has a phone, and he's the one who controls when, where, and how it is used. Ensuring, another thing that we've done in terms of pivoting our program is to ensure that services can carry on to be provided. So, sexual reproductive health services, we're providing those through online modalities, but again, that's coming through the digital network. We're using community members to be able to ensure that girls can access dignity and sanitary kits, usage of helplines, so that we can also look at issues to do with mental health and psychosocial support for these girls. As they're contained into their households, as they're moved away from their social networks, they don't have anyone to be able to talk to engage with. And so the helplines have become a real key source for them to carry on to be able to engage and interact with other young people during this period of time. Next slide, please. And so here we have a lot of examples of, from specific countries. I don't want to go into them. I'm being mindful of time. The PowerPoint presentation will be shared, but what it does is that it gives you specific examples through different countries of how they've ensured that they carry on to provide services for adolescent girls during this period of time. Next slide, please. So for more information, we've produced a number of technical notes. Again, we have these QR codes. If you kind of put your phone over them, you can be able to access these different technical notes, which basically were a way for us to be able to support our country teams with guidance on how they can continue to provide services, how they can continue to ensure that harmful practices do not carry on taking place during this period of time. Bissy has the PowerPoint presentation, and so I'm sure she can circulate that and people can be able to access the different technical notes. Next slide, please. I think that's actually the final one. Thank you very much, Bissy, and back to you.
Thank you so much, Nankali, for comparing that, and very detailed. I also like the fact that you mentioned the shadow pandemic. I mean, that is a double tragedy. Before I go on, I would like to call on one of our co-hosts today, Nonye. I don't know if she picked up any questions from the chat room for you. Nonye?
Yes, I'm just checking. Hold on, bear with me. No, not for now, no.
I was just wondering, Nankali, all the lessons learned and the strategies for the future, for future planning. I was just wondering, the situation in Africa, because we are talking about digitalization, data collection, these are things we already have challenges with. So how do you think Africa will fare in all this, number one? And then secondly, I was wondering, how come the strategy employed during Ebola in Sierra Leone failed to work this time around? Because I remember at that time when the government came up with the declaration that all, FGM should stop, it did stop, and there was a remarkable drop in the practice. So how come that didn't work this time around? Do you have information on that, or
Okay, so thanks so much, Bissy. I mean, the truth is that we just don't know. We don't know why communities have carried on to practice these harmful practices, regardless of the danger of them engaging with each other. And in fact, what we've seen, Bissy, is that community members, or those people, for example, who are facilitators of FGM, as an example, if anything, moved very quickly and have been providing, they've become even more proactive, reaching out into households, providing door-to-door services, announcing themselves even more. And actually the challenge for us that we've seen as UNICEF is that we didn't move as fast as they have, because we all went into containment and we kind of stopped, and the protection mechanisms stopped. But for these guys, if anything, they became even more energized. Had felt no fear, and have been moving around. Now, I think there's a story, I'm not an expert, there's a story about COVID in Africa and how it's evolving, which is very different from Ebola in terms of the infection rates, etc. So I don't know, it's something that we're still studying to be able to understand. So what is it? But the take home for me, Bissy, in all of this has been that we need to remain very alert and very vigilant at all times. I think when we talked about containment measures, many of us just went into pause, but there are some of us who there was no time for pause. They kept on, they kept pushing, and we need to be just as vigilant all the time and keep on, especially when it comes to harmful practices. On digitalization, I hear you completely that, in the African continent, what does that mean for us? So there's one part where, and especially the most vulnerable, where the most vulnerable populations live, they can't access digital technologies. But what I'm seeing as well, Bissy, is that there's digital technology in the sense of, some very grand and amazing things that people can do here in New York. And then there's things which are going on in my community in Tanzania, which is just WhatsApp. They're just sending each other WhatsApp messages. There's certain things which are so basic, and those ones, the integration into community is still quite high. But still, having said that, we picked up ourselves, the assumption that you have that all family members have phones is not true. Most of the time, it's the father who has the phone, and he's the one who determines when and where and who is going to listen to it. So if you're using the phone to protect a girl, to give her messages, how is she going to access if she doesn't have a phone in the first point? There's issues about reach, the networks, etc. Credit for the phones to what, etc. So those are all challenges for us, as we go forward. The good news is that I think, in terms of the development sector, very, very significantly focused on this right now and looking at how we can be able to expand those services and be able to reach more. But there is a group who will not be able to be reached. And for those, we do need to be able to design programs that can work for them in low resource settings and in settings that are hard to reach. So that there's definitely a challenge there that you're identifying, BC, that we need to take into mind as we happily jump on the digitalization train.
Thank you so much for touching on the technological divide as well as issues with data. My next question actually touches on something that somebody already typed in the chat. I don't know if Nonya wants to go there.
Yes, it's from one of the, pardon me, hold on, please. Yeah, there are quite a few. I'll read the first one. It says most of the communities claim to have bylaws to stop harmful cultural practices, but the reality is that these bylaws are not legally binding in some countries. So what would be the best way forward?
I think that's also touches on how come, the government cannot come out at the same time while they're addressing, the pandemic and the regulations to actually say stop these practices now.
Yeah, there is a second one, and it says there is a lot of underreporting by victims because of impunity, shame, and stigma. A lot of women are suffering in silence. What more can we do?
And then there's also a hand up there. Mina, is your question for Nankali?
Yes.
Thank you, Nankali, for that excellent information, your presentation from the UNICEF, from the larger perspective, and even for the previous presentation. My question, what I understood clearly was, first of all, it was quite surprising that the FGM increased and such a difference between Ebola and COVID during the pandemic. So I worked with my late good friend, Dr. Hilary in WHO. So I used to be a WHO staff, former. So I understood was that you talked about the digital technologies, and it is a fact that many places we presume that everybody is mobile, but it is really the head of the family which has the mobile. So the only difference which has happened from the landline is that head of the family is controlling the phone, and this is a very normal scenario. So which means a father, grandparents, or somebody elderly. Could this be an opportunity for NGOs, for other partners collaborating this, that we could leverage on this communication aspect, and how can we then assist you with UNICEF or with all the organizations here, including of course BDG, that we could create something very simple in a very simple language about the FGM or the girls, how they need to be protected, but addressing it to the how do we say, decision makers in the family earlier. So women know it's bad. Children will know that it's not a good thing. And how can we then in the community reach out to them who may not understand? And as you said, since the children were at home, it was a great opportunity for FGM workers to come quickly and also give a lecture on how families get converted into, it's a good time, everybody's sitting here, it will be sterile techniques, and and blah, blah, because I've seen many FGMs. So, and complications. So if I take it like this, what do you think? What your opinion is, Nankali?
Thank you so much, Mina. So yeah, I think so. In the beginning, there was a huge emphasis on digitalization and using the opportunity of phones, TVs, radios to push out information, and I think that still stands. And you know, while we know the challenges of it, but there is an opportunity, and there are a certain number of girls that we're going to reach through that. But we know that there's a number that we won't reach because, you know, they just won't have that level of access. And for those, I think what we've seen evolve in terms of the response by the time we've reached the end of this year now, is that the community protection workers have come back to working. And so, you know, we've equipped them with PPEs. They're able to go back into the communities. What they're doing is, for example, is that they're not convening at the large numbers that we have where we would be celebrating hundreds of people coming together. It's much more targeted. We're having smaller groups and, you know, meet up more frequently to be able to get information shared with them, to be able for people to know where they can carry on, to be able to access services that are available, especially around the economic impact, around sexual reproductive health services, etc. So one of the things that I've seen is that during this period of time, how civil society and particularly these community volunteers have really been frontline. They've remained there, and, you know, especially once we equip them with PPE, to be able to reach out, to identify where there are challenges and draw that to the attention of mandated bodies to be able to come in and support where necessary. I do see somebody typing in about the role of men. So I will leave others, because I do think that there's a role there about men and their leadership during this period of time as well. Back to you, Bisi.
May I say something?
Yes,
yeah. Hello. So I'm Letitia, cultural anthropologist, and I've been living and working for more than 30 years in many countries where there is female because of the very other reasons that you have mentioned. The mother, the attachment.
Yeah, we can't.
You can't hear? Sorry?
Go on, we can hear you, Letitia.
We can hear you. We can hear you.
Okay.
We can hear you. Please go on.
Thank you. So it's the same as some other reasons, because the attachment to the modern economy is reduced because of the isolation, the lockdown, whatever measures. Therefore, there is more, the only possibility to keep going is to revert back to more traditional practices. The female genital mutilation is an income maker, and for the people who do it, it is also a sort of assuring, as one of the speakers said, that the girl will be marriageable within this renewed, let's say, more conservative context, because that's what you fall back on. Falling back on a traditional society has its advantages and its disadvantages. In Thailand, during the first huge economic crisis, many of the Thai could survive because they still had traditional farming and vegetable growing skills, and could go back to this old-fashioned network. But it can also have negative things like increasing female genital mutilation. So there is an economic reason there. As for the digital technologies, yes, maybe the father has the smartphone, but many women own their own cell phone. Through the cell phone, you can still give messages. You can also equip, it's not expensive, smartphones are not expensive in Africa. You can equip one woman who is like a leader, or they constitute a group and they share the smartphone. And on that smartphone, you have applications which are especially helpful for women to empower themselves in access to health, knowledge, well-being, protection against abuse. So I'm a lot more optimistic about that. Then you say, yes, it needs credit. It needs a lot of other things. But the spending capacity, even at the village level, is increasing day by day. And if you create new poles of economic attraction, that are also in the hands of the women. By having more digital communication at that level, the servers, the providers are going to follow. I even in Tanzania spoken with Tigo, with Vodafone, with others. If you have a project that reaches out to clients that they would have to wait for years to get to them, they are going to do something. They even told me, if you get your application going, we are prepared to look at our extension plan to go to those villages first. So I think there is supply and demand that are together. You have the cell phones in the hands of women. You have smartphones, not expensive, that you could give or that women could pool together and have with $10 input each, they would have something for the village or for a small group. You have the possibility of special credit schemes like the students get for educational information. They have another type of credit for bundles so that they can do their research related to their studies. In the same way, you can negotiate for that type of subscription. Our staff did it in Bunga with the pilot project, so that works. So I see that there are lots of ways that you can counteract the activity of the female genital mutilation and other traditional harmful reversion to the past, and you can do it without being, what shall I say, confrontational, but you can do it in a gentle way because you have an attractive program that women and everybody can watch and participate in that is accessible at the village level. So I'm more optimistic there. Thank you.
Yeah, thank you, Latisha. Nankali had to leave us. She had to rush off to another meeting. I think we can now move on to our next speaker now, and that is Emile. Emile, are you here? Did he drop off? Yeah, he's there.
Maybe he's on mute.
Ah, okay. Emile, can you unmute yourself?
Yes.
Thank you.
Exactly. So thank you very much for giving me the floor. So when you told me to talk about violence against women and girls, I was very happy because this is one of the issues which is in my country. So I'm Emile BAGUMA. I was born in Congo, especially at the eastern part of the DRC, where I can say it's like a killing and ground place. It is not like that. So I'm a former seminarian, a former Catholic seminarian. That means I wanted to become a priest, and then I stopped on the way. So at least I had quite time with Catholic priests. I visited different countries. I went in Tanzania, Zambia, Congo, Malawi, Mozambique, South Africa. So at least I know different countries and what is going on about violence against girls and against women. So women are subjected to various forms of violence daily, in particular physical violence such as beatings and injuries, mental violence as insults, verbal threats, slanders, and sexual violence like rape and sexual harassment. Sexual violence is the most reported from the gender-based violence, but many survivors are afraid to report rape and violence to the stigma and the fear of reprisal from perpetrators. My country is still in conflict, as you know, Congo is still in conflict, and security, food insecurity, and then even pandemic, COVID-19, and I can't forget about Ebola. Up to now, some people that are still saying no, Ebola is still theirs, with others that are still saying no, there is no Ebola. But up to now, we don't know the reality. So the government is saying no, Ebola is finished, but people are saying no, Ebola is still there. So about COVID-19, people are not taking seriously about COVID-19. They don't know. So sometimes we say, no, just wear a mask. They don't know at all about it. Talking about violence against women and girls, probably for me, it's like a chance to talk about one of the experience I lived in the village. I went one day in the village just to visit a hospital, just a small hospital, because we want to launch an application of JamboMama. That means the application of Leticia, talking about girls and women just to control their pregnancies and different stages. I arrived there. We were surprised. We went to one of my friends, medical doctor. We were surprised when they talked to us about one experience they lived last, maybe now 3 months or 4 months. One lady was raped by three guys, three rebels. They came and the lady was just going just to cultivate, and then on the road, she was raped. And then after raping, when the lady went back home, and talking to a father could not understand, and the village knew that the girl was raped, and the girl was preparing already a marriage. So unfortunately, the boyfriend refused the girl. He said, "No, I can't get married to you because you don't belong to me now." On my side, I felt very bad to hear such experience of that lady because no one could not understand if it can happen in the village. So, and then we asked one of the question, did you talk to government about what is going on? They said, yes, we talked to government, but the government is still saying, so we are going to, yes, we understand the situation, but we are going to react. To understand the situation, we are going to react. Up to now. Immediately, I remember a great American politician who said, there is no problem for population, but there is something wrong with our politics. That's true. And about a cause and the consequence of gender inequality. So ladies are taking this time in some society like object, They don't take them seriously. Some they just take like a pleasure, And some ladies they understood as if their pleasure that they are under men. And for me, sometimes when, for instance, we used to go to visit prison because I work there. I work with my friend, a medical doctor. I want just to visit some women in the prison in Bukavu Central Prison. And then one lady talked us about what was happened last time. He said, no, I could not understand my brothers. So last time there is one guy, just a guard of the prison, but he came and said, no, he has to sleep with me so that I can give me money to have food. So ourselves could not understand. And I was really touched by what is going on. And then the lady, we asked, is it really true that the guy came and he asked you about sex and then you accepted? The lady said, no, what am I going to do? You know, our society is so poor, so I don't have money to eat. So when, for instance, I just go to him, immediately he will give me some money and then we sleep together. And the money I'm going to get, it will be for my security. I will be secure first among women. They will treat me like one of theirs. And then that guy, the guide, I will take power. He will give me power over our women here. So myself, I was surprised. And after 1 year, according to what we heard, that lady got pregnant. So after getting pregnancy, the guy ran away immediately. So he was a soldier. Immediately, according to what I heard, the guy ran away. And then he left the lady like that. And then when we ask about it, but there is saying, no, what can I do? I don't have anything to do about it. So I talked to that situation to Leticia about what is going in prison, raping, and the lesbianism which is going on. And then some they used to say prison is let me say they used to say the best place where prostitution is at the high level in Congo. They used to say like that because some ladies that are coming from outside just going in the prisons, just selling sex. So I talked to that issue about Leticia, but even Leticia was surprised about what is going on. And then he said, no, we can just try to launch our application, JamboMama, in the village. So especially in the village to see what is going on. And then myself, I went to the village, a village which is called Kalehe, is almost 30 kilometers to my place where I'm living. And then we started talking to women. When we hear what the women are talking about, they, I mean, the way they take them is like they take them like they don't take them like a partner. They just take them like objects. Some they just take them like those who have just to go to cultivate. Some they take them as if they are the one just to make food for their husband. And then I say, no, what is the proof? They say, no, the proof you can see a man can have even 4 women. And then having 4 women for them it is like legal. When you say no, why a man can have 4 women? They say no, for us we are happy. Because when, for instance, he can just give me whatever I want, if he can give me money, he can give me sex, he can give me this one, myself, I'm just happy for that. So that one is one of the challenges we are living. Others, they don't even control their pregnancies. So some, they used to say each and every week, they have to record at least 3 or 4 cases of raping. At least 1 or 2 weeks they have to record 3 or 4 cases of raping. So what they used to do, they used to send them to the hospital. As you know, there is a one of our doctor Mukwege, Dennis Mukwege, is the one who is really dealing with that issue of raping. But unfortunately, for the time being, he can't manage because there are many now. And then my place now, South Kivu, now they have a lot of rebels, and then ladies who have been raped. There are many. They are uncountable now. So that's why I used to say no. If, for instance, for him it is very difficult to deal with such issue, why he can't alert the government immediately? The government can intervene. So I talked to one of his member and I asked him such a question. He told me, Emile, what you can do, even if we talk to our government, read the story. We talk to government this one, the government say, no, just wait. We are going to look at that situation. Very soon we'll talk about it. And then it is very, very difficult to deal with such a situation. Violence against women and girls also has an impact of the lives of many women beyond the survivors. The fear of violence can prevent women from pursuing education, working, exercising their political rights and voice. This is what we have been living. So some in our society, especially my place there, if for instance a lady was raped by a rebel, by a man, so immediately she will not be able to continue her studies. She'll just be afraid. She will be as if, no, if for instance I'm raped, so I can't be already, I'm no longer a girl. I'm like an object now. So they need really through psychological counsel so that they can understand that they belong to the society. And that's what sometimes they used to do to that hospital where we want to visit. I talked to the medical doctor who was there. I said, no, normally these ladies, one for instance, we just record 1 or 2 cases before sending them to, they say, to the one who can help them, Dennis Mukwege. You have first to advise them. You have to understand what they are going through, what they are going through. Because some, for instance, they can just go to men because of food. They don't have something to eat. Some they can just go to see men because they just want money for their education. They can't afford money to pay school fees. And then what they do, they say, no, let me just go to a man. And then teen marriages, it's not only in Congo. I lived in Zambia because I've seen someone. She might be a Zambian. I was in Mansa. I mean, in Luapula province of Zambia. The place where I lived, it was Kasamba. It is really a village, and then to go to different substation could take even 2 days just to reach there to meet with local people. And then what we live there, it was teen pregnancies, early marriages. It was really at the high level. Because myself I was youth chaplain, I used to talk with ladies, to men too much. So, and sometimes we can see ladies, they say, no, I need a man just to feel comfortable. I need a man just to be in security. But when we say, how old are you? Maybe 16, others 15, others 12. And then even their families, they are sending them. They're sending them to men. They say, no, at your age, you are already 18. You are old already. You have to get married. You see, such a situation, it is very difficult. Uh, A recent Gallup survey shows that in every region of the world, women constantly feel more insecure than men, although the level of security significantly vary across regions. And that's true. Women really they feel more insecure because some places, even Zambia, even Congo, especially the place where we went for 2 weeks. For instance, when a lady or a girl want to go to cultivate, she can't go alone. She has to go with a man because she can say, no, if I go alone, very soon I'm going to be raped. So if I'm going to be raped, that means I'll be neglected in the society. Because in the society, if for instance you are being raped by a man, immediately you are not they don't consider you as a lady, as a woman. So that one is really a serious situation people are living up to now. And then we are still talking to some politician about what is happening, because I talked to one guy, he's just a councillor of that district. I said, no, if for instance you know what is going on here to your place, why you don't report such a situation? And they say, no, we used to report. Each and every time we report immediately to the district commissioner. But the district commissioner has to report to the provincial sector, but the provincial sector doesn't react. So on our side, what are we going to do? So we have just to report, and if the provincial sector they want to talk about such issues, they want to intervene, so they're most welcome. But if they don't want, for us, we don't have anything to do at all about it. Because sometimes you can even meet some guys from that place themselves are raping ladies. They say, no, why to get married in that there? Violence against women is not only a cause of gender inequality, it is a consequence of it. In many places, gender-based violence is reinforced by discriminatory laws and exclusionary social norms that undermine women and girls' opportunity for education, income, and independence. This is what people are living, especially in that place in Congo, about violence against women. Women, they are no longer secure. They don't feel comfortable. Some they are flying each and every day. You can see in town, you can see a lot of people are just flying from villages to town because of insecurity.
And finally, the lessons learned in terms of addressing on how we can address GBV in the current situation. And finally, of course, I would very lightly speak about the OHCHR's work. We all agreed that, of course, in all the previous interventions, we agreed that GBV are social, economic, political acts that are deeply really rooted in gender inequality. And these acts will be directed against a person because of their gender. They are usually caused by patriarchal attitude or stereotypes. And it might happen both in private and public sphere, as Madame Gbedemah rightly highlighted. Usually this will affect or could be either neglect or denial of women's civil, political, economic, and cultural rights. But unfortunately, it's not a matter of one or two countries. It's really a pervasive issue which affects all countries. It also undermines girls' women's rights, right to life. It affects their dignity. It affects their security. It affects their autonomy, as the previous speaker said, and it really affects all areas of their lives. So it's really a scorch. So, and we also saw from recent evidence that reductions in public spending, emergencies like displacement, conflict, as Emile just mentioned, natural disaster can really weaken state responses when it comes to gender-based violence because of the lack of institutions, the collapse of institutions, or the complete disappearance of any form of duty bearers this will really affect the attitude or the enjoyment, the full enjoyment of girls and rights when it comes when they in case they experience gender-based violence. So having said this, what have we seen as a matter of what has changed in terms of protecting, preventing women against sexual gender-based violence, particularly given the recent events and the recent pandemic that we live, and what have been the impact, the consequences, and the barriers in terms of women's enjoying their full rights equally and fully their rights. We all agreed that GBV is a global scourge. Of course, it affects all countries. It has been exacerbated by COVID. But now COVID have unfortunately disrupted all programs and infrastructure that usually are in place to reduce gender-based violence and to protect also women's rights against that issue. So maybe I can frame the consequences and the exacerbation in threefold. The first one is that we have observed a deepening in the existing pre-existing, usually we call it pre-existing inequalities, like the chairperson said, particularly where we used to have infrastructure that were unevenly distributed. For instance, in a country where you have regions that are more better equipped in terms of facilities, in terms of public infrastructure, the likelihood for women being affected or being hit by the COVID was really high for those in the areas where they were less equipped. And also, secondly, it has exacerbated also the risk factors for discrimination and violence, because discrimination is the fundamental principle. Non-discrimination is a fundamental principle. So some have really been touched very hardly affected by economic distress. We mentioned that many of the parents losing their economic income were recurring to using marriage, as Emile mentioned, marriage just as a coping mechanism, as a protection measure for themselves, or as a economic source for economic income. And also we saw that, of course, school closure, as Nankali said, school closure was also a very important factor, factor for discrimination and violence. Why? I want to mention here one of the questions that was highlighted. Why is it that we realize that with the pandemic, with the current COVID pandemic, we have more, the prevalence rate of FGM, for instance, is much more higher than the prevalence rate during the time of Ebola. It's very simple, because the risk factors are there. When we had Ebola, everyone was at home, and everyone, very specific community were under quarantine. But with the pandemic, the COVID pandemic, it's not only that you have some of the safety net, economic safety net, social safety net, every asset that were in place to protect girls and to prevent any forms of harmful practices were completely disturbed. The functioning of those infrastructure was disturbed. I want to mention school, they were closed. So usually it's in the school area that you usually have those alerts whenever there's a risk for harmful practices. Safe spaces, which include clubs, leadership clubs, and wherever all these girls meet to exchange, to share information, and to get appropriate or proper information and be protected as well. All this infrastructure had completely disappeared. So that's why you might have such increase in number of rape. And also looking at the restrictions that some of the country faced. Because of restriction in movement, because of you had those women, a very high number of women being forced to live with their spouses, or children living with their parents, and also combined with the level of distress brought by the COVID, with the uncertainty on the future. This has really affected the behavior of many of those perpetrators. So that's how you had the survivors and the victims that were hit completely hit and really experiencing domestic violence because of that combination of factors. So, and finally, it has also unfortunately contributed in reducing the capacity of state and other stakeholders to protect. I mentioned the schools, safe space, shelters, and any forms, even the likelihood for the police to take action whenever there were any report of violence, domestic violence. It also, of course, finally affect the ability of survivors and victims to report and to enjoy their rights. Well, because of course of the dysfunctioning of the protection and social services. So that's why you had that we can believe that really the situation of women, those who are survivors and victims of gender-based violence, has really worsened, and this led to an alarming increase in the multiple forms of gender-based violence. It was also reported, particularly by UNFPA, that the increase there is an increase actually of up to 30% of the domestic violence rate. This is an average, a global average. So it means that it happened everywhere, and it's continuing to happening everywhere, unfortunately, because of the lockdown. And we know that we are currently almost everywhere in the world. We are currently in the second wave, and some might enter in a third wave. So it means that even the likelihood for going back again in containment it's very high, and with of course with the risk of violence that we know. So this also in terms of consequences, it is expected, as Nankali mentioned, that during the average of 6 months, in an average of 6 months lockdown, we might have 31 million of people experiencing additional gender-based violence, type of gender-based violence, which is extremely high as compared to the normal rate that we usually have. And of course, at least 13 million additional cases of child early and forced marriage, and of course 2 additional million of cases of female genital mutilation. And looking at those facts, looking at those figures, one can just conclude that unfortunately the situation is basically undermining the progress that have been made over the past years, and it also somehow compromises the likelihood for us to reaching the target that were set by the Sustainable Development Goal by 2030. So we hope that we might find possible solutions, and that all actors will get involved in a very innovative manner to make sure that we address these consequences, and then we mitigate also the causes for the risk factor, the impact of the risk factor for GBV. So what can we do? What do we do currently? What are the mechanisms doing, and how individuals can use those mechanisms? I will just very briefly go on that, because this chairperson already, Madam Gbedemah, already covered one part of this, and I will just focus on the other aspect that we might want to look at. There's a really, I will just first by saying that there's a consensus on the need to find new way of thinking, new approaches, and also new ways of making sure that we address accountability. We all heard what Emile said regarding the difficulties and the challenges that women face in conflict context, just to be able to report or even be protected, to be prevented from experiencing rape and from experiencing sexual violence in a context where the likelihood is very, very difficult. There's an absence of institution because of the conflict, and also there are very limited resources, financial resources, just to cope with the poverty, the ongoing poverty. So it's very complicated, and it's very also at the same time challenging, and it really it also calls for combined and multi-sectoral action to address this. On the UN side, the UN Secretary General made a global appeal to prioritize prevention of GBV in all measures. So for him, because we all agree that it's a pandemic, GBV, it's already a pandemic, combined with the COVID pandemic, which makes them worse. So for him, he wanted all the stakeholders to get engaged to address GBV, and this will happen through what he called the political engagement strategy on GBV and COVID. Actually, it's one of the main drivers for addressing the pandemic, GBV, in the context of the COVID. The main objective is to make sure that a member state and all the stakeholders, because it's not only the responsibility for member state, CSOs, humanitarian actors, development actors, women's organization, all come together to accelerate the political response to gender-based violence, and also to promote zero tolerance for gender-based violence in all spheres of the society, being it at in the private domain, in the family sphere, or in the public sphere. So this is something that he really wanted most of us, or all of us, to get involved with in a very coordinated way, so that we have also a multiplier effect in terms of impact. So, but what does it mean? What does this political engagement strategy means in practice? I think it covers what we have always done, but now with the new paradigm, the change in paradigm, and also the new challenges that we have with COVID, it means that we really have to think more strategically and in a very structured manner. He has designed it into four main pillars, which should really guide our interventions. The first one being that funding should be more flexible and made available for women's organization. Prevention should also look at how we involve men. I know there was a question on how men can be involved in preventing GBV, how we can involve also other sectors, such as the education, the media sectors, and other actors in the field, community leaders, traditional leaders, all the actors that have a say and that can play a role. Women themselves, girls themselves, and boys, and all other actors. And also, of course, looking at the response, how we can respond in a very innovative manner, given the challenges that we have, and finally collect information in a disaggregated way, so that we actually inform on the situation of different groups based on the age, based on the gender, based also on the status, those living with disability, those living in remote areas, those living in conflict settings, those in displacement, those living in camps, in refugee camps, etc. I mean, making sure that we have the overall picture, because the way someone is affected depending on their geographic location may change. No? If you're, let's say, if you're like, you share, like as Emile shared with us, if you're living in DRC, particularly in the eastern part of DRC, South Kivu, or in South Kivu, or in North Kivu, and as a woman, your situation is completely different from someone living, for instance, in Kinshasa, in the same country. So just to mention that, and to really identify those different factors and those, how do they call it, they call it variable, I mean, those different criteria for assessing the situation of someone. So these are the four pillars that have been identified, and how that are actually guiding how the work should be done. As I said, normally for funding, it was agreed that COVID recovery plans and strategies should really prioritize those funding, making them flexible and available. And to that extent, I know that many of the usual donors, they have changed their policies in terms of allocation of funding. They have also mobilized additional funding to resource and to finance grassroots organizations, but also women's defenders and other actors who are involved in addressing GBV. And on prevention, I know, for instance, our office OHCHR has been working a lot on making sure that there is a man's co-responsibility in preventing GBV, and in the sense that they should be the actors should work towards changing the mindset, changing the behavior, promoting positive masculinity, and working together with men, so that they are not there as perpetrators now. They are not seen as perpetrators, and even when they are perpetrators, there are actions that are taken just to address the causes for that violence, because it was said, it was evidence and report shows that those who perpetrate usually were also at the time survivors and victims of violence themselves, usually in the families here. So the Guatemala office, for instance, have been working, launching a kind of information series on how called Men Under Confinement. So for them, it was a very positive way to promote masculinity, a positive masculinity in the fight against GBV. And also, yes, of course, other offices, like for instance in Cameroon, they worked with media to address the stigma associated with the COVID, and looking at the different discrimination that women and other actors could face in facilities, in healthcare facilities, in the public services, etc., in education sphere as well. And finally, promoting economic stimulus package to increase, for of course, integration of this in public policies. On data collect, I wanted just to add that, yes, it's very important to have those disaggregated data, but something that was very very important for the policy, for the SG policy, is to make sure that whatever is done, even if data are important, they shouldn't be, collection of data shouldn't be at the expense of women's protection and women's safety, meaning that whenever a situation where data is collected and this could further expose women, like a group which requires particular protection, let's say, Emile mentioned lesbianism, but let's say, imagine a situation where you have people from LGBTI people who are in a particular setting, and you want to share about the different the types of violations that they face, and you want to share to share the figures, and you will think twice and ask yourself whether this information would not further expose them. So we shouldn't really expose further women at the expense of because we want to collect data. I will really go quicker because of time. And finally, in terms of response, making sure, of course, that there's an increase in number of shelter, there's an increase in number of counseling center, support services. It was mentioned by Madame Gbedemah, access to justice whenever possible. It was said that because of the closure also of public institutions, including the justice sector, some other innovative way of addressing justice was, for instance, to set up virtual courts, so which is a very nice way of addressing this. And also, I know in Kenya and Uganda, for instance, there was NGOs that put together a mediation center, mobile mediation center for family facing dispute or facing violence in the context of COVID. And of course, making sure that hotlines are available 24/7 and that there are alternative accommodation place for survivors. I remember discussing with the women's defenders from Syria, where they were saying it's not possible in a conflict context to have shelters because of the collapse of all institutions. So how do we do? So it was also agreed that we can always find alternative accommodation places, like looking at museums, because of the closure of all institutions, this could be used as just to welcome them, or social centers, or any other places that are hidden and that are unknown by the perpetrators, just to ensure that there's an increased protection. In terms of role of mechanisms, I will maybe take one additional 2 minutes, BC, so that I don't take too much time. In terms of role of mechanisms, Madame the Chairperson mentioned the Special Rapporteur. She indeed issued a report on really to welcome the efforts, but also to recommend that there should be a really shift in terms of the way we implement legal policy, political and cultural measures towards addressing gender-based violence, and also ensuring that we address the structural inequalities. Not only, we don't look at GBV as an individual issue, but it's a societal issue which needs the implication and involvement of all different constituencies. And finally, the Special Rapporteur on freedom of assembly, he is speaking on the role of defenders, because they have a very strong role. They are at the front line of all the efforts. He mentioned the need for further protection of those against reprisals, and also a need for increased funding. And finally, of course, making sure that these are represented in a recovery plan to make sure that we have sustainable results and impact. And looking at the work that treaty bodies, including the CEDAW committee, does. There's an additional way to ensure that individuals could be protected by those measures. But just to mention that usually these mechanisms could be seized when there are no guarantee at the national level or regional level, and when there is no satisfactory response by the national justice system. And any individual, any woman, any survivor can have the right to lodge a complaint, an individual complaint to one of the complaint mechanisms. And CEDAW is part of the convention that have allowed this, that have allowed this. And but the state party, the country should be a state party, and also the country should have accepted that competence. And finally, as lessons learned, it was already touched upon, but maybe very quickly, it's very important, as I said, mentioning the 4 pillars. Under each of the pillar, we have really seen an increased efforts and in innovative manners and types of interventions, so that we can really overcome the barriers, the limitation in terms of physical distancing, in terms of lack of access to people who are in remote areas, lack of access to information. I mean, some of you really, even some of the intervention from the participants already mentioned this, but just to add that there were increased efforts to engage in networks, and these are valid, particularly pertinent and relevant in contexts like conflict contexts, where you have women who are really in vulnerable position. And when they organize themselves in networks, usually it's a very counter power. It has a counter power effect. So that's why I know, for instance, Tatiana Mokanire, who is the head, who is coordinating the national efforts for GBV survivors in DRC. She's doing a very good job. So it's very important for former survivors to organize themselves this way, and also, of course, collaborate with other actors for more protection. Mediation, and mention it, fiscal stimulus. At least 28 countries have already integrated this in their policy. I also mentioned national coordination efforts. Liberia, for instance, started reforming their policies, but they also gave more additional resources to the national task force. Decided, for instance, to close or open schools to make sure that girls will be protected as a preventive effort. And also, of course, in Kenya, we had similar efforts, and now more national helplines. We saw it particularly after the first the first wave in April. So we see more and more action towards that aspect. Strengthening services. We saw, for instance, in Egypt, that shelters remain open to make sure that there's a protection of survivors. And in other instances, there were also more efforts to make sure that women, and particularly GBV survivors, are not discriminated on the basis of their health status. For instance, if they were tested positive, they were still accepted in those facilities, but with, of course, the health and sanitary precautionary measures for their own protection. Finally, I just wanted to say that also, as an office, we have really been working on those 4 pillars, and we have also developed as UNICEF some guidances on all the issues that OHCHR's mandate cover, which means all human rights issues. But we have 2 guidance notes on women and protecting the rights of women and the LGBTI persons. And of course, we continue to support and to work, including as the Secretariat for all the mechanisms, the UN Human Rights Mechanism, and to make sure that we also contribute with other actors to those collective response efforts towards GBV in COVID. I will stop here. I'm sorry if I took too much time, BC. I give back the floor to you. Thank you.
Thank you so much, Carol, for that very comprehensive presentation. Now I would like to open the floor for questions. Noye, do we have questions we received before and those we picked up from chat? Noye? Letitia, please go ahead.
Yes, I just wanted to say that in the context of what we have heard today, a lot of the violations of the women's and the girls' rights, which are their human rights, are really related to their sex, to their biological sex. It's just as if that is still used as an excuse to see them as inferior or to use them as objects. So there is something we have to do there, and we should not run too fast and discuss everything from the perspective of the subjective gender social role attribution, but really go back to that issue, because it's there where it hurts most. We've heard how Emile spoke about it. I know from the experience with the maternal care, with pregnancy care, delivery care, postpartum care, there's still a lot of violence, because that seems to be a vulnerability that at the same time provokes some kind of jealousy, perhaps because of it's also a sort of power. Being able to give life can also be viewed in the subconscious of humanity, and particularly of man, as a source of power that has to be counteracted with oppression. So I think I would like to plead for us not to forget that at the moment the trend is very much to concentrate on gender identity, but the issues related to giving a woman, as a girl, her human rights, yet being a woman, that we still have to do a lot of work there. And the more we get removed from an urban environment, the more we have to be cautious to do that. It starts with female genital mutilation, which is something physiological and biological. You cannot do it to a man. You can do something different, but not that. So I really wanted to say that we do not forget this and try to overcome that first.
Thank you so much, Latisha. Biological differences are there, and yes. I mean, these are there. There's nothing much anybody can do about that other than transgender surgeries. But you are very right. We can at least try to minimize the consequences that result from those biological differences.
Just to add a little bit to it, because I think it is like a monstrosity that girls begin to think that becoming a mother, that her biological function is like a curse. It's not a curse, it's a gift. If it is lived as a curse, it is because of the way society, and particularly a male-dominated society, is working with it. But we should never forget that female genital mutilation, it's the women who transmit, encourage, and do it too. It's not something that the men ask. I've spoken to many men who said, for me, it's, but the women of the house do it. Everybody puts the guilt on someone else, but the women are involved too. And that is why I feel we should not have to fight for our rights by having to forgive our womanhood. That is not the right way to go. I don't think so. Thank you.
Thank you.
BC?
Yes, Lois, nice to see you.
I want to compliment all the speakers and you as moderator. This has been a very enlightening, comprehensive, and professional webinar. I wanted to note that about a week ago, WONRUN, which is the Women's UN Report Network, gave a presentation at King's College in London on self-harm. And self-harm is under the umbrella of patriarchal prescriptions on the female body. And I hope that we can continue that thematic discourse more, because it's enormous but hidden, especially during a pandemic and a lockdown. And so when we're talking about invasiveness, harm to the female body, we also need to be aware that anxiety, victimization, all kinds of negative forces, including harmful practices, can result in self-harm. It's a new frontier.
Thank you, Lois, for coming in with that. It is indeed true that it's a question of mental pressure, and these are things that can result into people who can know, when they get to the limit, it's now exhibited in self-harm. Any other comments? Any other questions? Maybe I should now go back to our different speakers for any additional thoughts they may have. My big sister Hilary.
Thank you, BC. I am right here. And I also want to thank my colleagues who have spoken, all the comments, very, very valuable. I probably just want to leave with one or two comments. When we look at the issues of self-harm, women's bodies, the harm, the mutilation and all, it's also important to scrutinize this carefully. Sometimes not sometimes, in the case of female genital mutilation, it is done by women, yes. But why is it done? There is a patriarchal underpinning to make a woman ready for marriage, to curb her sexuality. There's a whole lot of baggage we cannot go in right now. But we must not forget the patriarchal underpinnings, and that women are sometimes used as agents of patriarchy and rewarded in the financial gain that they receive from these processes. So we need to keep these things also in mind, the self-harm, the anorexia, to put women's body in a shape that society endorses. So this is a very heavy area, and I will urge us to look at CEDAW's General Recommendation 31, done together with the CRC General Comment 18 on the harmful traditional practices, especially as they refer to women. Now, the second one is bias. I am unapologetically a legal educator, and my focus is education. We need to look at education again, empowering education, the kind of education that we give girls that empower them and not just re-entrench societal stereotypes. Education should be a transformational and empowering process. Therefore, and I will not go into all the World Bank studies as to what education will do when you end the second cycle for women. The studies are there. But what I want to say is that a lot of time we look at the school as a place for learning, and that's it. No. That is why when schools close, we must take a careful view at what happens. School is a place not only for learning, but for empowerment, for social, economic empowerment, everything. And therefore, when the schools close, this is what is lost. And therefore, to me, it is no wonder that when the schools close, the incidence of female genital mutilation will increase. Because this is one of the things school protects from. School sometimes gives a hot meal. It provides sanitary commodities. Therefore, when there's no school in progress, the girls have to go elsewhere to look for the hot meal. It provides protection against exploitation. We need to unpack school so that the minute school closes, we see what it is that has disintegrated and put in measures to correct that. Thank you.
So now, can I ask, with the competing issues that our government now puts in place, and I think Nankali mentioned that, you find that issues to do with girls and women are now to the corner, because during pandemics, they want to focus on the palliative measures. They want to focus on how to reduce, curb the spread, the transmission. So how does that come in now, to ensure that these issues remain in the forefront?
We need, yes, I do understand, but I'll just give a very brief answer because this is a really big place, a big space. We need to reclaim school. our ministries of education, our CSOs must reclaim school. And some of the suggestions were given. We must look at the alternatives, smaller groups, more intensive education, simple fact sheets. I do agree with everything that has been said about digital technologies. I agree. It's a geographical divide. It's a class divide. And we have to look at the alternatives to bridging this gap. Everybody on board, even churches, religious organizations must find their women's organization, market women. When the girls can accompany their mothers to the market, there should be a place there that they can be educated. And we must find innovative ways of reclaiming school. Thank you.
Thank you so much for that. I like that, reclaiming education. And it's not just the textbooks, different methods can be using, simple fact sheets. Yes, thank you so much for bringing that up. I think our Ministry of Education were a little bit slack in that regards. Yes, Mina.
A very quick comment on what Hilary just mentioned. It's very important. And when you're reclaiming the schools, I think it's also the teachers, because what's happening is we should be having some kind of a little training, layman's language, simple things, because what happens is we are teaching the children, yes, we are through the various civil, CSOs, etc. But then we are teaching also the faith-based. But what about the teachers? How do we know? And I know of some who still believe, and they again are in the same circle of patriarchy or whatever, that they believe in that very, very, very much. So how can this become also a little, it's not adding another period to the curriculum, but just like you learn to wash hands and they're told about hygiene, etc., could we have put something very simple that I'm more than happy to work with BDG and UNICEF and all of you, very simple measures that the teacher understands and she just has to read, he or she has to read, so that even the boys and everybody knows. Because when I have, I'm sure you are also more enlightened on this, the boys also say it's a good day for them. They wear a good dress, because really, believe me, I've also traveled a lot in all Africa and I've seen complications of FGM. So I know it from first hand. They say it's a lovely day and they just, even the girls don't say anything. The boys know that something very special happened. They get a new dress, clothes, it's a feast. It's almost like having the periods for the first time, and some places they celebrate. So it's very important if the teachers, because many things, what teachers say sticks in the head, it's how does so much education till today we remember something told to us in kindergarten, first grade, very early. We are not talking about when they reach that this is a bad practice. Number one, like WHO says, it is not in any way healthy. That's the only line they say. That's why it's called mutilation. It's not called a female circumcision because we were there. Why it is called mutilation? Because you're mutilating. So that's all. Sorry for taking longer.
Yeah, it's okay, Mina. Emile? You are muted. Emile, do you want to say something? Please unmute yourself. Yeah.
Yes, please. So I support the idea of Hilary about education, because what I know, the education is the best way to empower ladies and women. Because if, for instance, a lady is educated or a woman is educated, she will be able to raise her voice, to talk out about what she thinks, and then she can exercise even some political right. So you have to give education a place par excellence in our society, where a lady will take it as the best way to empower herself. Because if she's educated, she can do whatever she can. She can even create some jobs. She can do better things than men can do. So as we know, Nelson Mandela said, education is the most weapon which can change the world. Thank you very much.
Thank you so much. Caroline, do you want to add anything to all that has been said?
Yes, thanks. And thanks for your very your precious comments. I really agree with most of them. And maybe just a few words on education. It's true. I really agree with all the previous speakers on that. And I also believe that we also have to look at education really broadly, no? Because we speak about education, but we should not forget to mention that when it comes to education, it's also a matter of a way of channeling information, any sort of information that we want to channel. And this applies, of course, to children at an early age, but also, of course, to the various sectors that we have that also have an influence on the education of those girls, most particularly the education sector. So even those, the teachers that have to be there to educate the children, they also have to be educated. That's why we have that concept of making sure that having comprehensive approaches to address any sort of harmful stereotyping and discrimination, and making sure, of course, that they understand actually what could bring harm into the life of those girls and women. And having said this, I think it has been conceptualized under what Madame Gbedemah said, which we can find in Article 5 of the CEDAW Convention. It's stereotyping. And I know my office, OHCHR, has tried really to work on understanding how harmful stereotyping are being constructed, and trying to address them in the sector, in the education sector, in the justice sector, and also in the media, because these are places where really harmful information is being provided, how people are being uneducated. I don't even know if that word exists in English, and they are being disconstructed in the way they see the place of any individual in life. In the education, yes, of course, you work on curricula, as Mina said, you work on the content, education content, didactic content, everything that will build and that will construct the girl in the way she sees herself as a part of a citizen in a given society. And of course, moving to, I don't know whether we have lawyers or judges here, you know how a magistrate, the reasoning, the judicial reasoning that they use, also making sure that in their judicial reasoning, they don't use false excuses to excuse a crime, a rape, for instance, or they don't also use false excuse to prosecute further someone who is not.
What do you mean by false excuse?
Yes. Sorry?
I said, what do you mean by false excuse?
Yes, indeed. This is what we call harmful stereotyping. For instance, we know that GBV is based on constructions. We spoke about patriarchy, patriarchal structure of the society, and also a social construction, the way attitude, attribute that we and role that we give to different people in the society. So if we consider that in a society, if it is considered in a given societal set that a good woman is the one who should be virgin, to get married, she shouldn't, even myself, unfortunately, I heard that when I was at law school, a woman should not go beyond the bachelor degree, because otherwise she will not get married. A woman should not go too much to school, because in any case she will get married and she will become a good for her family-in-law. And I mean, all this construction, innocently, I'm sorry to use even innocently, naively, we use those constructions, social constructions, which unfortunately build also our social norms, and which build our law, and which also build the work of the justice sector, the education sector, and the media. Can you imagine when a girl is being raped, and the way media actors, they just look at the excuses? Yes, what was she wearing? What was she doing in that area? She should know that that area is unsecure, etc. She shouldn't go in the first instance to the room of that guy. So unfortunately, all this attribute, role, and definition, and I don't know. I mean, the way we see women in society has really impacted in the way also we behave with her, towards her, the way also we define her rights in legislation, and the way this legislation are being implemented whenever there's a discriminatory act and behavior that happen. So this is for the first aspect. And last aspect is something that really is really dear to me, and it's based also on the comment that Leticia made. Leticia, I really agree with you, but I just wanted to add a piece to what you said. We have sex, we have gender roles, but we have gender identity, which are completely different. We cannot confuse the two. When we talk about gender roles, it's whenever what we were talking about, the stereotyping, what are the roles that are attributed to a woman in a society? What are they expected to do? What positions are they expected to occupy? What places are they expected to occupy? For instance, if you are talking about representation and participation, public participation, if in a given society, a woman is defined as the one who should stay at home and just implement caregiver responsibility, it means that whenever she will run for a public office, she won't be elected or she won't be appointed, because in that given society, a good woman or a woman is the one who is meant to stay at home. And that's why maybe in certain contexts, maybe I'm drawing a very quickly a conclusion, in certain contexts, women are not given, they don't see themselves as active actor, active agent in the society, because they believe that it's only when they will have a man beside them that they will have their full existence, they will reach their full potential. I'm taking the example that Emile said. So it's very important to make that difference. And then gender identity is the way you identify yourself as a man or as a woman. This is absolutely not related. And I want to reassure you that it's very key. Women are half of the population, are those who suffer the most of GBV that we are discussing, and hence they have the priority in all the interventions that we have, all the policies that we support in terms of design and implementation. So I really wanted to clarify that so that we don't make any confusion. Yeah. Okay. And I thank everyone. And I wanted to say more, but I think we are running out of time. So I will just.
Sorry, can I ask a question? And it's to all the panelists. I totally agree about education and education empowering women. But I'm the one who wrote the questions about having men as allies in all this as well, because you do need men as allies. But there's also an aspect, because you can inform people to the wazoo and you can empower people to the wazoo. But there's also that aspect of changing behavior, changing mindset. So my question is, what are the tactics, what are the strategies about changing those mindsets to get people on board to follow us along as well? Because even when it comes to empower women and women, we get the education, you're still going back to a home. Just an example that where you might be abused. So you've empowered that person, but there's no change in behavior or mindset as well. So what are we doing with that too?
You want me to go first, BC? You're unmuted.
Yes, sorry.
You're muted. Yes. Okay. This is a very good question, Funke. Yes, it's what we go. We need to go a comprehensive approach now and multi-sectorial approach, which means that when we look at, we know that there are 4 pillars in terms of, or let's say 3 pillars when we want to address GBV. We have a prevention, and I'm sure the chairperson will not contradict me. We have everything that has to do with prevention, which include, of course, law reforms, legislation. We have prevention, which means all the different actors that should intervene to make sure that we change mindset, we change attitude, we change behavior, and this falls under that one. And when we look at the constituencies that actually contribute to change social norms that perpetuate, that condone or justify GBV, you have men themselves. As I said, men are always seen or often perpetrators, mostly perpetrators. So what we have to do is, even in terms of education, that's why I said education should be seen in a broader perspective. It's a matter of information as well, how they are informed and how they are taught. I don't know if that's the right word. So how they are, what information, how they are involved, or how they engage so as to address and to prevent GBV. In many contexts, you have even seen some. I know that what's the name again? There's a very well-known organization that actually put together men. put together in form of network, so that they commit to learning. They go in shared spaces and they learn about what is having a positive masculinity, what it means to be a man without having an aggressive behavior towards their spouse, towards the kids, towards their children, the way they raise them, and what it means to really be an ally in terms of making sure that there's no violence, because we know the cost, the economic cost, even the social, the societal cost of violence. So they are really put into contribution to make sure that they themselves change their mind, and they also go houses by houses in the Latin American context. In Africa, they go houses by houses, door by door, sensitization sessions where they also inform, they push others to change their behavior in football, in sport clubs, and I mean everywhere where you usually have those men gathering. So, and they are very important allies, because without them, as in that perspective, it's very difficult to change things, because you go, as you said, you go back home and then you have the same behavior. And as also Madam the Chairperson mentioned, it's very important also for boys to start at a very early age, and Nina, at a very early age at school, in any other places, in social clubs, and wherever the education could be provided, so that at least they understand, they have another perspective, just to deconstruct that social, those social construction towards the role and the place of women in society, because they are individual and they are also should have full rights. But also other actors, and not only men, you have at community level, you have traditional leaders, you have religious leaders, you have women themselves, you have community-based organizations usually involved in alert system, alerting on issues of harmful practices, and of course beyond that you have teachers, as I said, you have media organs, media actors, you have the justice sector, you also have the economic sector, the private sector. I mean, all these actors have a role to play. So it's very important to have that comprehensive and intersectoral approach.
Thank you so much, Caroline. Any more comments from the floor? This has been very rich exchanges, and I really appreciate each and every one of you. We've said a lot this evening. Male constructs, men are, I wanted to talk about positive masculinity. Men are necessary allies. They are perpetrators and they can also be allies. So we need to explore that avenue. But I was wondering, we've said a lot about young girls, but not much was said about older women and what they faced during the pandemic. I know in Africa we have a different context. They are mostly within the family setup, but they also were at risk of abuse, and the digital divide, the communication divide. These were things they went through. So I don't know if there was anything that, any experiences from any of our panelists on how this was addressed during the pandemic, especially within the African context, because this is a group. If we are to ensure that we leave no one behind in achieving all the sustainable development goals, how do we ensure that the older generation, especially the older women, because when we talked about the male in the household holding the phone, it applies even to the older women. Sometimes, especially the rural women in the villages, is the men who had access to the phones, who had access to the data. Now I know mobile phones is very common and everybody has it, but data and connection to the world, I think that is something very important. So when we are talking about education, we need to also think about educating this group of people to ensure that they are not left behind. So on this note, I think we can safely round up. We've said a lot, and I've picked up a few points on things that we can take forward, So for me, my take home here is, women were faced with the triple tragedy of not just being women, but of the pandemic and the government's unpreparedness to address this issue and to also ensure that they don't suffer further. So we need to continue to increase our innovative efforts, very creative efforts that I've seen and I've heard about this evening. We need to leverage on those in response to violence against women. Community surveillance was mentioned. I don't know how, that's very possible, especially in the African context and at the village level. I also like the fact of reclaiming education through creative means, not necessarily classroom education, but using other methods to ensure that people are educated. Another important take home for me is how we educate the men to get them to deconstruct the stereotyping, the social expectations from women. Our girls are being educated, not necessarily in school, but even from home. She's been socialized from birth. She's been socialized and orientated towards taking care of family, taking care of children, taking care of her man. Are the men given such opportunities as well to learn how to take care of the women? Some, especially African men, are very responsible when it comes about taking care of the children and providing for the family, but taking care of women, how they should be taken care of. These are things that we need to, work more on. We need to continue to speak up in whatever spaces we are. We need to make gender our agenda. No matter what sector you are working on, make gender your agenda, mainstream gender into everything you are doing. Speak up, continue to speak up against violence against women, continue to lobby the government because we need these things. A lot of measures were talked about this evening. We need to ensure that these measures are, that they get to the grassroots where they are really needed. Thank you so much, everybody, for your patience. We've gone well past our time, but it was such interesting discussions and I didn't want to cut it off. And I wish everybody, very happy holidays, season's greetings, stay safe. For those that are traveling, have a very good time with your family and looking forward to seeing you all again next year. Thank you so much.
Thank you.